Assertive Community Treatment, ACT, is a beacon of hope for those with severe mental illnesses. ACT extends beyond traditional clinical settings, recognizing that true recovery happens within one's life context. By providing comprehensive services, ACT helps individuals manage symptoms and strive towards their full potential. ACT breaks down barriers that hinder recovery and community integration. It fosters seamless collaboration among a multidisciplinary team, ensuring coordinated care. This approach empowers individuals with a reliable support network. ACT provides high-intensity services to meet the complex needs of individuals with severe mental illness. It adopts a holistic approach, addressing mental health, physical health, social connections, and more. ACT teams are available 24/7, offering flexible and frequent support. ACT is designed for those who haven't benefited from traditional services due to severe symptoms or co-occurring disorders. It targets individuals with severe mental illnesses and substance use disorders. ACT aims to prevent hospitalizations and promote long-term stability and community integration. ACT empowers individuals to live fulfilling lives by managing symptoms and preventing crises. It goes beyond crisis prevention, supporting recovery, independence, and hope. ACT provides tools and resources to help individuals achieve personal goals. ACT believes in the power of recovery, embracing hope, healing, and transformation. Recovery is a personal journey of growth and empowerment, supported by ACT teams. Individualized treatment plans reflect evolving goals and aspirations. Recovery requires community integration, which ACT fosters by connecting individuals to resources and opportunities. ACT teams assist with housing, employment, education, and social activities. By breaking down barriers, ACT promotes a sense of belonging and inclusion. ACT aims to help individuals live meaningful lives beyond symptom management. It empowers individuals to pursue passions, discover strengths, and contribute to their communities. ACT fosters a strengths-based approach, encouraging personal growth and fulfillment. ACT relies on a multidisciplinary team approach to provide comprehensive care. This team includes professionals from various disciplines, working together to address all aspects of well-being. The collaborative effort ensures holistic and individualized support. In ACT, care responsibility is shared among all team members, fostering accountability and support. Regular team meetings ensure coordinated and integrated care. ACT teams engage with individuals, families, and other providers to create a network of support. The success of ACT hinges on the strength and cohesion of its multidisciplinary teams. Teamwork provides comprehensive, and individualized care, empowering individuals to achieve their goals. Effective ACT teams create a synergy that transcends individual efforts. Fidelity in ACT ensures adherence to core principles and practices, creating a harmonious model. It's about embracing the spirit of ACT and maintaining its core values. Fidelity distinguishes effective ACT programs, empowering recovery, and community integration. Measuring excellence. Tools and standards for assessment. Ensuring fidelity in assertive community treatment requires a systematic approach. Standardized tools and established fidelity criteria have been developed. These tools provide a structured framework for assessing key elements. One widely recognized tool is the Tool for Measurement of Assertive Community Treatment, or TMACT. The TMACT delves into team composition, caseload size, and service delivery practices. Another tool is the Dartmouth Assertive Community Treatment Scale, or DATS. These tools utilize staff interviews, client surveys, and record reviews. Assessment results are translated into fidelity scores. These scores highlight areas for improvement and excellence. Fidelity assessment is an ongoing process. Regular assessments allow programs to monitor performance and make adjustments. The importance of regular reviews. In mental health care, resting on laurels isn't an option, especially for ACT programs. Regular fidelity reviews foster a culture of continuous improvement. They provide opportunities for reflection, learning, and growth. Like a ship needing course corrections, fidelity reviews keep ACT programs aligned. They ensure alignment with core values and practices. Reviews allow teams to step back and engage in self-assessment. Teams can identify strengths, weaknesses, and develop action plans. This involves revisiting ACT principles and engaging in honest discussions. Insights from reviews empower teams to refine practices and enhance care. Fidelity reviews embrace continuous learning and growth, ensuring vibrant and responsive ACT programs. Alex, a 30-year-old man diagnosed with schizophrenia, had endured a revolving door of hospitalizations for years. Traditional outpatient services had proven ineffective. Then Alex was referred to an Assertive Community Treatment, ACT team. The team recognized Alex's journey required a holistic approach. They built a trusting relationship, meeting him where he was. The ACT team developed an individualized treatment plan. They assisted him in finding stable housing and employment services. They celebrated his successes and believed in his potential for recovery. Maria's path. Overcoming challenges, embracing recovery. Maria, diagnosed with bipolar disorder and substance use disorder, had a history of trauma and unstable relationships. Traditional outpatient services were insufficient, leaving her feeling lost. Her journey with Assertive Community Treatment, ACT, began with building trust. The team approached her with empathy, creating a safe space. They addressed her mental health and substance use challenges together. Encouraging social support, they helped her reconnect with family. The ACT team remained a source of unwavering support and hope. Navigating the labyrinth. Challenges inherent in ACT. Assertive community treatment, while lauded for its transformative potential, is not without its inherent challenges. Implementing and sustaining ACT requires navigating systemic, logistical, and human-centered obstacles. Securing and maintaining adequate funding is a formidable challenge. Workforce development and retaining qualified professionals are significant hurdles. ACT programs often operate within a fragmented mental health system, navigating complex regulations and funding streams. Charting a course. Strategies for enhancing ACT effectiveness. While the challenges in assertive community treatment are significant, they are not insurmountable. By embracing a proactive, strategic, and collaborative approach, ACT programs can navigate these obstacles effectively. Just as a skilled sailor adjusts their sails, ACT teams must adapt and innovate to maximize their impact. Strengthening partnerships within the mental health system is key. By forging strong alliances, ACT programs can expand their reach and leverage shared resources. A beacon of hope. Reflecting on the power of ACT. As we conclude our exploration of assertive community treatment, it's essential to pause and reflect on the profound impact this model has had on the lives of countless individuals with severe and persistent mental illness. ACT is more than just a treatment approach. It's a beacon of hope, a testament to the power of compassion, collaboration, and unwavering belief in the human potential for recovery and growth. We've delved into the core principles of ACT, explored its comprehensive and individualized approach to care, and witnessed its transformative effects through compelling case studies. We've examined the critical role of the multidisciplinary team, the importance of Fidelity in implementation, and the ongoing challenges and strategies for enhancing ACT effectiveness. Throughout this journey, one resounding theme has emerged. ACT works. When implemented with fidelity and embraced with unwavering commitment, ACT empowers individuals with severe and persistent mental illness to reclaim their lives, achieve their goals, and live meaningful and fulfilling lives within their communities. ACT stands as a shining example of what's possible when we move beyond traditional paradigms of mental health care and embrace a more holistic, person-centered, and community-based approach. It's a model that recognizes the inherent dignity and worth of every individual, regardless of their mental health challenges, and empowers them to live lives defined not by their diagnoses, but by their strengths, aspirations, and contributions to the world around them. A call to action championing ACT and shaping the future of mental health care. While we celebrate the successes of assertive community treatment, we must also acknowledge that its reach remains limited. Too many individuals with severe and persistent mental illness continue to face barriers to accessing this life-changing model of care. It's our collective responsibility as mental health professionals, advocates, policymakers, and community members to champion ACT and ensure its availability to all who could benefit from its transformative power. we must advocate for increased funding for ACT programs, ensuring they have the resources necessary to provide high-quality, comprehensive care to all who need it. We must support workforce development initiatives that attract and retain qualified professionals dedicated to the principles of ACT. And we must challenge stigma and discrimination surrounding mental illness, creating communities that are welcoming, inclusive, and supportive of individuals on their recovery journeys. The future of mental health care lies in embracing models like ACT that prioritize recovery, community integration, and person-centered care. By working together, we can create a world where individuals with severe and persistent mental illness are no longer defined by their diagnoses, but rather empowered to live lives filled with hope, purpose, and meaningful connections. Let us move forward with a shared commitment to championing ACT and transforming the landscape of mental health care for generations to come. Together, we can create a world where everyone has the opportunity to live a full and meaningful life, regardless of their mental health challenges.